This year, we are presenting the symposium in a monthly format. You will see hour-long presentations at least once per month through December. This month, we are pleased to present a community symposium youth program. Gateway Medical Society was established in Pittsburgh in 1963 as a component of the National Medical Association, and our mission is to eradicate healthcare disparities. Our mission is the foundation that inspires all of our programming. We provide education to promote public health, raise awareness of the healthcare disparities in our communities, collaborate with other groups who have similar missions, and work to increase the pipeline to yield more physicians and scientists of color to address those disparities. Last month, we collaborated with the Pittsburgh Black Nurses in Action, bringing you valuable information on maternal child health resources. Today, we are featuring students in our Journey to Medicine mentoring program as they discuss Your Sleep Matters. The Journey to Medicine program is one of Gateway's signature programs. We are very proud to present a panel of knowledgeable ninth grade students. They will be moderated by our own Dr. Jan Madison, one of the physician directors of the Journey to Medicine program. I'm sure you will gain valuable information this morning. I welcome you and thank you for your participation today. Before we continue, I would like to take a moment to thank our symposium partners, including the Heinz Endowments, Highmark, UPMC, the Links Incorporated, Gateway Health, Pittsburgh Black Nurses in Action, my sisters at Alpha Kappa Alpha Sorority Incorporated, Alpha Alpha Omega Chapter, the Ivy Charitable Endowment Incorporated, and anyone that has helped us with this endeavor. Now, allow me to present our moderator, Dr. Jan Madison. Dr. Madison is currently a pulmonary critical care physician who has worked the past 27 years with the Pittsburgh Pulmonary. She is currently employed by Allegheny Pulmonary of the Allegheny Health Network of Pittsburgh, PA. Her hospital practice is at Allegheny Health Network Jefferson Hospital with outpatient offices near Jefferson and at the waterfront. Dr. Madison is a graduate of Yale University and University of Pittsburgh School of Medicine. Her postgraduate medical training was completed at Emory University in Atlanta, Georgia for internal medicine and the University of Pittsburgh for pulmonary critical care. Dr. Madison has been a longtime member of Gateway Medical Society. She has served in all offices and currently is the fundraising/grant manager for the Journey to Medicine program. She is a strong patient advocate and is committed to closing the gap in healthcare disparities. In addition to Gateway, she is a member of Allegheny County Medical Society, American College of Physicians, American College of Chest Physicians, and American Thoracic Society, and has served as president of the medical alumni of the University of Pittsburgh. She currently sits on the Board of Trustees for the National Medical Association Region 2. Dr. Madison is married to Bobby Simmons, and they have two sons, DeMarcus and Devin. An Eldridge Cleaver statement she learned as a child is her mantra. If you are not part of the solution, you are part of the problem. That is so true. Dr. Madison, thank you so much for being a part of our program today and for moderating this panel discussion. Will you please begin with telling us a bit about the highly successful Journey to Medicine program and then introduce our panelists. Dr. Madison.
Thank you, Dr. Isaac. Thank you all for being at our community symposium and listening to the youth symposium, which is about to begin. Journey to Medicine started in 2010 with our first class. We were supported by our founding sponsors, Heinz Endowment. Over the years, we've had many, many partners, and I would not try to list them all because I'm afraid I would be remiss in leaving someone out. But thank all of you who have supported the Journey to Medicine. Journey to Medicine is a pipeline program. We are trying to fill the pipeline for African-American males to become physicians. There's a crisis in the United States for African American male physicians. From 1979 to currently, the number of African American males who matriculate into medical school has dropped. We want to be part of increasing that number and increasing the number of African American male physicians from Pittsburgh, PA. I am one of the physician directors, along with Drs. Anita Edwards and Dr. Bill Simmons, in continuing with the program with Journey to Medicine. We are very proud of our students and we want them to be successful young men. So one of the things that's very important is that they learn how to share information with others. That is the purpose of our youth symposium. So today, they will share with you the importance of sleep and why your sleep matters and why you should be very involved in making sure that your sleep is good. It is not enough to say, oh, well, I'm not sleeping well because A, B, C, and D. And they want to make you aware of some of the problems that people have with sleep or that they experience as a result of sleep disorders. So stay tuned in. And at this time, I'd like to present our ninth grade students who will be doing the presentation, Your Sleep Matters. And their Master of Ceremonies is David Compton. David?
Good morning, everyone. Like Dr. Madison said, I'm David Compton, part of the teaching class of 2024, and today we are going to be presenting about sleep oddities and sleep disorders. Can someone tell me in the chat quickly what happens to your body when you fall asleep? Someone said that your body is getting rest so that you can prepare in the morning, which is true. When you sleep, your body undergoes a series of changes that enables the rest to your vital overall health. So first, we're going to talk about the process of sleep. There are many stages. Obviously, we don't just close your eyes and fall into deep sleep immediately. So the first stage is the lightest stage of sleep. When you first close your eyes, it usually takes 1 to 7 minutes to occur. Some things that happen during this first stage are that your heartbeat slows, your breathing slows down, eye movement slows down, your brain waves begin to slow down. The second stage is just light sleep, usually occurs with 10 to 25 minutes. Heartbeat and breathing slow down even more. Your body temperature drops, and your brainwave activity slows even more. The third stage is deep sleep, which usually occurs between 20 and 40 minutes. Your heartbeat and breathing slow down to its lowest level. Your muscles become even more relaxed. The fourth stage is REM sleep, which also occurs in 20 to 40 minutes. Behind your eyelids, your eyes move rapidly from side to side. Your heart rate increases and your blood pressure. Next. Some more processes of sleep is NREM stage 1, which is basically just entering sleep stage, which lasts about 5 to 10 minutes from when you first drift off. NREM stage 2 is when your body falls deeper into sleep and unconsciousness, which lasts from 10 to 25 minutes.
Recording in progress.
NREM stage 3 is when your body goes into the deepest level of unconsciousness, which happens from 20 to 40 minutes. And REM stage 4 is the final stage where your body is totally unconscious and it begins the dream stage of sleep. REM versus NREM. In stages 1 to 3 of NREM, your body is still going to sleep, and stages 1 to 3 of NREM, you're still slightly aware of your surroundings. So you may be able to hear some people talking. If someone opens your door, you'll wake up. And REM sleep is stage 4. Your body's completely unconscious and has no control over voluntary movement. Your brain also uses special nerve pathways to send signals to your brain to appear as dreams so that you don't act out your dreams. Next. Having a good sleep routine and sleep hygiene. This is so important because your sleep routine and your sleep hygiene really affects the quality of your sleep. If the quality of your sleep is bad, then you won't feel rested. You can sleep for 8 hours, but if it's not good quality sleep, you probably still won't feel rested. So here are some recommended hours of sleep from ages. So for an infant age birth to 3, it's 12 to 15 hours. For a child ages 3 to 5, it's 10 to 13 hours every night. For a child ages 6 to 12, the recommended hours are 9 to 12 hours. From 18 ages 13 to 18, the recommended hours are 8 to 10 hours of sleep every night. And from adults 18 to 60, the recommended hours is 6 to 8 hours. Next. It all ties into sleep deprivation. Sleep deprivation is when you're just simply put not getting enough sleep, and it makes your everyday activities harder. Some symptoms of this is, like I said, fatigue. Your mood changes. You'll be angry and you won't be able to function very well. Memory loss. It's going to be hard for you to remember things. Concentration is going to be even harder for you to concentrate. And the most extreme level is hallucination. Next. Some things that you should avoid when you're going to sleep is technology. When you're on your phone or computer or laptop, whatever you do, I recommend that if you're doing that before you go to sleep, take some time between when you're on your technology to when you go to sleep so that your brain has time to slow down. Because if you're on technology and then you lay down, your brain will still be awoke and stimulated. The more things to avoid is caffeine, nicotine, and alcohol. They cause dehydration and other complications when you are trying to sleep.
Hi, my name is Andre Smith, and I'm doing What Helps You Fall Asleep. Next. Some sounds that help you fall asleep. Pink noise is a frequency of sound that is a calming sound, and it also falls into like certain beats. Like if you're listening, scents also help you fall asleep. Lavender, listening to music also helps whenever you're falling asleep, and flowing water, like crackling fire, that also helps. And next now, scents, like I said, lavender, jasmine, and vanilla are also scents that help you fall asleep. Your brain has receptors that picks up the scents, and it boosts memories and helps calm you. And you could like ways to use them are burning them and sniffing them or putting them into diffusers. Next. Another topic of sleep are sleep oddities. Next. Parasomnia is basically abnormal or unusual behavior of the nervous system. It's basically, it causes your body to move while you're sleeping. So some people who have parasomnia, would experience sleep talking, sleep walking, or sleep eating, or restless leg syndrome. And it's very treatable, but it's more to affect children than adults. And also, it affects women twice as much as men in adult years. Next. Insomnia is the difficulty of maintaining or initiating a regular sleep routine. It causes depression or schizophrenia. It can also cause cancer, stroke, or Alzheimer's disease. And it's basically whenever you just can't fall asleep, or it's just really hard for you to maintain a sleeping schedule. So say you fall asleep at 10 o'clock at one night, and then the next night you're falling asleep at 4 o'clock in the morning, and you just can't get on a certain sleep schedule. Next. Another sleep oddity is sleep apnea. It's basically whenever you're trying to sleep and it's your breathing is like really, really bad, and it'll like you breathe randomly and it stops and starts during sleep. And sometimes whenever you have sleep apnea, you'll snore a lot, and it just makes you have you could have high blood pressure and have strokes, and it could lead to heart diseases. And it's mostly seen in people who are overweight, but it can happen to almost everybody in all age groups. And next.
Hi, my name is Lamont Tomlin, and I'll be starting with narcolepsy. It is a disorder characterized by the extreme tendency to fall asleep whenever in relaxing surroundings. It can be affected by anybody around the childhood, and there's no like real cure for it, but it can be cured by medicines and lifestyle changes. Next. Next, sleep paralysis. It's a feeling of being conscious but unable to move. So it's like you're stuck in your bed, but you're half asleep but half awake, and you're able to like see things, but you're not able to move. You're not able to like talk or anything like that. Out of 4 to 10 out of every person might be able to have it. It can be treated with medicines and lifestyle changes, just like narcolepsy. Next. Here are some like pictures of kind of like common sleep paralysis, which could be happening while you're having it. Next. A lucid dream is when the dreamer knows that they are dreaming and are somewhat in control of their dreams. This happens if you gain a slight consciousness while still in REM sleep. You're basically able to control what happens in the dream while you're dreaming, and it happens like an hour and 30 minutes after you fall asleep. It's more common in the younger ages, and it could also treat like nightmares and stuff because you're able to control your dreams. Next.
In conclusion, the three main things that we want to leave you with is that sleep has many flaws and oddities. These affect a lot of people around the world, and maybe even some people actually know. Having a good sleep routine and hygiene are crucial for quality sleep. Like I said earlier, if you don't have quality sleep, then you're still gonna wake up in the morning feeling tired and not energized. And sleep is a necessity, so get your rest. Thank you. Do we have any questions from the audience?
Hi, this is Dr. Madison, and we are going to take questions from the chat. And oops, sorry, I didn't realize I was still muted. Hi, this is Dr. Madison, and I will be moderating our question and answer session. We do have some questions from the chat, so I will read the questions, and whichever one of our panelists feels that he would like to answer the question, please feel free. Our first question is, what should people do if they are having trouble sleeping?
Some things that you can do if you're having trouble sleeping is make a better sleep habit and try to be on a schedule. So maybe you should turn the TV off 20 minutes earlier, or lay in bed longer, or turn the light off, or whatever. Well, yeah, something like
And anyone else like to add to that answer? And one of the things that our students discussed also was certain sounds and certain smells may make it more comfortable and easier for you to relax and fall asleep. Our next question in the chat is, if you don't get enough sleep one night, do you think taking a nap during the day will help you feel better rested?
It'll help you feel better rested, but you shouldn't really do it, because if you're going to take a nap during the day, then that makes you more awake at nighttime, and then it'll mess up your whole sleeping schedule. And that's the problem with you having to maintain it. So you might want to just try and push it out through the day and fall asleep at your regular time at night, so that way you're not tired or staying up later than you normally would.
Okay. Thank you. Next question. How can you get sleep paralysis?
You can get sleep paralysis when you're in between the stages of like being awake and being asleep, and you kind of like gain consciousness, and you're not really able to like talk or move for like a few seconds before you realize that you're kind of like paralyzed a little bit.
And the interesting thing about that, as he said, is it's a transition between being awake and being asleep. And we all have those transitions. And generally, we don't remember that transition. And if you do happen to wake up and be aware enough, it is only a few seconds and definitely a normal phenomenon. Next question in the chat. I had sleep apnea, and I'm wondering if it can come back or not.
It depends on your diet and how much you're exercising, because it affects like people who are overweight, or say it affects more women than men. I'm not sure why it does, but it does. And if you're more likely to be overweight, then you might want to just exercise or maybe diet, and that'll help you out. Unless it could, or if you don't maintain a strict diet or exercise plan, then yes, it possibly could come back.
That's a really good answer. And in addition to that, I'd like to add that sleep apnea can be caused by obesity, which is one of the reasons that exercise and eating right is fine. Some people can have a surgical cure of their sleep apnea if it's due to their tonsils or adenoids. So it just depends on the cause of your sleep apnea and what you did to make it go away on whether or not it can come back. Next question in the chat. Can you truly catch up on your sleep? Working long hours at night and sleeping extra the next day?
You can't. Well, you said working overnight. Is that the question? Working overnight.
If you work at night and so work shifts and during the day, can you catch up on your sleep from day to day?
I think you can. It's just gonna be extremely hard because it's pretty obvious at night that you're supposed to be sleeping instead of working. During the day, you're probably gonna have things to do that you have to do during the day. So it's probably gonna be very hard to catch up on your sleep. But if if you have good self control and just knowing that maybe it's like 4 or 5 o'clock and that you need to get to sleep, then I think you can catch up.
Okay, thank you. And are there any foods we can eat to improve our sleep? And I'll add to that question. They also wanted to know, what is the connection between caffeine and sleep? So are there foods or beverages that affect the way we sleep?
I'm not sure if there's any foods that can help you sleep, but I do know that there's foods that can stop you from sleeping. Pretty much anything that has sugar in it, because sugar kind of, like stimulates your brain, and that's the same thing with caffeine. When you're sleeping, your brain is supposed to be slowing down, and all caffeine and sugar does is speed it back up. So,
I know there are questions in the Q&A, but I'm not able to get to them right now. And what do young people do to fight sleep?
Sometimes younger people fight sleep because they either want to be on their phones or watch TV all night. And that's really a problem if you want to maintain a decent sleep schedule. So if you, the younger group of like teenagers and people today, if they really want to have a better sleep schedule, then they have to control themselves and not be on their phones as much or watching TV. Because as we said earlier in the presentation, light and other things such as loud noises can affect your sleep and how your brain just isn't slowing down whenever you're watching something that piques your interest.
And the next is a question, thank you. And the next is a question for all of you. Do you feel that your sleep schedule is unusual compared to your peers? And what do you think has affected in addition to cell phones, which you recently just discussed, and gaming, what other things have affected your ability to fall asleep at night?
Temperatures, like if I'm really hot or if I'm really cold, that really affects how I fall asleep. Because me personally, I like to fall asleep with like my fan on if it's hot, and if it's cold, I'll get an extra blanket or I'll just really go under my comforter, and that also helps me fall asleep because that plays a big role in sleep as well and how you fall asleep.
How about Lamont, David? Any other comments on what makes it difficult for you to fall asleep, or what things keep you awake at night so that you really don't want to fall asleep early?
There are like certain things that I do every night, like it can help me go to sleep. So if I were like somewhere else, for example, like if I were to like sleep at a hotel for a night, my process of going to sleep might be a little longer because it's like not normal, like the normal things I do. It's a little uncomfortable, so it might take me a little longer to fall asleep.
And David?
I feel like everyone has their different preferences about what makes them go to sleep. So like for me personally, I know I shouldn't do this, but I put on like a YouTube video or something that I don't really care about that doesn't grab my attention to help me fall asleep. And for some people that it may distract them, it may not be the best idea for them. That's what I do to fall asleep.
Thank you. The next question, do you think that anxiety and depression affects sleep? And do you have any ideas why that happens?
When you're anxious, um, I think we can tie that back to you overthinking, like thinking about everything, and like your brain just working and working and working. And like you said earlier, the point of sleep is to stop that from happening. So like if you have anxiety, really bad anxiety, your brain is working very hard trying to sleep. That can really cause bad, like not good quality sleep.
Thank you. And the next question is, do you think that during COVID and the pandemic and being either in a virtual space for school or sometimes in person school, does that change your sleep and affect the way you rest and how you go to bed at night?
Being in person school, there's probably like more work that you have to do after school, causing you to stay up a little longer than probably whenever you're online. Because whenever you're online, or at least for my school example, I go to Central Catholic. Whenever I was online, the majority of the work I really didn't have to do after the entire time I was online. It was really during the Zoom meetings. So I would sleep a lot earlier than staying up whenever there's fully in-person school.
I'm interested in the opinions of the other panelists.
I think being being online definitely, I think it helped my sleep schedule and it ruined it at the same time because I knew that in the back of my mind, I knew that I didn't have to be that attentive in the morning. So I would like stay up longer because then I would just like after school just go straight to sleep. But when you're in person, I think I know that I have to be up early, like to catch the bus at like 6 o'clock. So I definitely get more sleep when I'm in person.
Okay. And Lamont?
Like I said, yeah, kind of the opposite of David. I get a little less sleep whenever I'm in person because there may be like some after school activity I have to do. And after that after school activity, I still have homework to do. And on top of that, I have to wake up early to like try to catch the bus. So I get a little less sleep than whenever I'm online.
And Andre. Thank you. Andre?
Whenever I was online for school, it definitely helped because there were parts and classes that they didn't have us go into Zoom calls for. And they would literally let us sleep through it, and they said we could. So I mean, it definitely helped, but at the same time, this year it might be a little bit of a problem because I'm not going to be able to get the extra 45 minutes of sleep that I may have gotten last year. And it'll also be a problem because my sleep schedule is, I have to get back on the sleep schedule for school. And I also have to wake up earlier than what I did whenever I was online because I have to shower and then I have to go to the bus stop and do a bunch of other things.
Let's see. And we'll have, let's see. One of the last questions that we're going to answer today came from our viewers. Do you think that daylight saving time matters? You know, the clock switches forward, the clock goes back, it gets early, it gets light earlier or dark earlier. Does that affect your sleep? Does that affect the way you're able to do your usual activities?
I think daylight savings does affect your sleep, but I think it's kind of mental because when it's getting dark earlier, when it's getting dark earlier in the winter and later in the other months, your brain kind of thinks so it's getting dark, so I'm gonna go to sleep earlier, and I might be tired earlier, so that seeing it being dark may affect how much sleep you get, or maybe when it's 7:30 and it's still light out, you may think, oh, I still have time left in the day, so I'm gonna stay up an extra few more hours.
Right. And actually, that's part of the discussion about should we have standard time all the time and should we stop switching back and forth from daylight savings time to standard time? And do we have one last question? So before we get ready to close, do any of our panelists have anything that they would like to add to their previous presentations, or we will begin with some of our closing remarks and get ready to close our program. Any of our panelists have anything that they would like to add?
I want to say thank you for listening. This presentation, we started working on this in I don't know, it's been probably since October, November, around that time. So thank you for participating.
Andre, Lamont, anything you'd like to add?
I wanted to say same thing as David. Thanks for your time, and it's really appreciated.
Yeah, I just want to say thank you too for listening.
And as our panelists, I would like to thank all of you for joining us. We are very proud of our young men in Journey to Medicine, and they can tell you that they've come a long way from the presentations that they did when they were in 6th grade to being able to present to all of you today. As David mentioned, it took a lot of preparation for them to be here, and they also created their own PowerPoint that they felt was going to be helpful for all of you to read along, because there is quite a bit of things that happen in the initiation of sleep, the maintenance of sleep, and the end of sleep into wakefulness that we take for granted every day. And they did a very nice job in talking about all of the different components of sleep. So we hope that each of you, if you have any sleep issues, feel free to discuss this with your physicians, because sleep is very important and it definitely matters. Gateway Medical Society is definitely behind our young men who, even if they don't become doctors, we are confident are going to be successful in life. We want to thank you for your participation in our symposium. We want to make sure that you check us out on the website and know that each year we take a new group of 6th grade students. So if any of you know students who are going to be in 6th grade, please reach out to us through our website, gatewaymedicalsociety.org. And Ms. Tamara Reese will be happy to get your information and help with the onboarding of new students. Please take a picture, save our contact information, 412-281-4086, and our website, www.gatewaymedicalsociety.org. Follow us on Facebook and Instagram. Please take a look at all of our sponsors that are listed, and we appreciate their sponsorship, and we appreciate your sponsorship of our students, because it truly takes a village to train the next generation of successful young Black males. Again, thank you for spending your Saturday morning with us, and enjoy the rest of your day.